Today, we're diving into a medical mystery. It's one that affects millions of women all over the world, but somehow it stays hidden in the shadows, totally misunderstood and massively underdiagnosed. We are talking about endometriosis.
Just look at this number, 1 in 10. That's not a small number. It means if you think about your friends, your coworkers, your family, it's almost guaranteed that someone you know is silently fighting this. It is an incredibly common disease that we just don't seem to talk about.
So let me ask you, and be honest with yourself. Have you ever had period pain so bad that you had to cancel your life? I'm talking about missing school, calling out of work, bailing on your friends. Have you ever actually vomited or even passed out from the pain?
And if you have, has anyone, maybe even a doctor, ever told you, oh, it's just a bad period, or maybe hinted that you're just not good with pain? If that sounds familiar, you are so far from alone. It's a story so many women know, and it is beyond frustrating.
You know, that exact experience of being dismissed is why we have to talk about this. We're looking at a disease that's not just common, it's hiding in plain sight. Get this, for women who are struggling with what's called unexplained infertility, up to half of them are later diagnosed with endometriosis. It's the hidden culprit behind so much pain and heartache.
Okay, so to crack this case, we've got to start with the basics. We need to unmask our main suspect. What is endometriosis, really? At its core, endometriosis is a chronic inflammatory disease. What happens is tissue that's supposed to be lining your uterus, the endometrium, decides to grow outside of it. And because that tissue is not where it's supposed to be, your body freaks out. It sees it as an invader and launches an attack, which means your immune system is basically fighting itself. And this right here shows you the central problem. The tissue inside your uterus, it has an exit plan. It sheds during your period. But the tissue outside, it has nowhere to go. It's trapped. And it does the exact same thing as the normal tissue. It responds to your hormones every month. But because it's trapped, it just gets inflamed and angry, causing this constant battle inside your body.
All right, let's play detective. What are the clues your body might be sending you? What are the signs that point to endometriosis?
Clue number 1 is pain, but we have to totally redefine what normal period pain is. If the pain is so bad it's running your life, that is a huge red flag, especially if it started when you were a teenager. Other big ones? Pain with deep intercourse. And this one is massive, major gut issues. We're talking bloating, diarrhea, constipation. Sound familiar? So many people get told they just have IBS when it's really endometriosis in disguise.
And this inflammation isn't just localized. It causes problems all over your body. It's that bone-deep exhaustion you can't sleep off. It's that brain fog that makes it impossible to focus. Your body is basically running a marathon 24/7 just trying to fight this inflammation. You also have to look at your family tree. If endo or other autoimmune issues like thyroid disease run in your family, your own risk goes way up.
So you'd think with all these clues, getting a diagnosis would be pretty straightforward, right? Well, this is where the plot thickens. Getting a diagnosis is notoriously hard, and it's all because of this one central twist that makes no sense at first.
This quote from Dr. Natalie Crawford really hits on the core paradox of this disease. The stage of the disease, how much of it there is, has absolutely nothing to do with how much pain you're in.
So here's the deal. You could have just a little bit of disease, what they'd call stage 1, but if it's super inflammatory, you could be in agony. On the flip side, you could have stage 4 with tons of scar tissue and have less pain. The key takeaway is this: your pain level tells you nothing about how advanced the disease is.
And that leads us to one of the biggest, most damaging myths out there. So many people are told, well, your ultrasound was normal, so it can't be endo. That is absolutely not true. The vast majority of endometriosis is completely invisible on a standard ultrasound.
Yeah, maybe an MRI could show some clues sometimes, but the gold standard, the only way to know for sure that you don't have it, is for a surgeon to go in with a camera and actually look. So let me say it again, a normal ultrasound does not, and I repeat, does not rule out endometriosis.
Okay, let's talk about one of the biggest ripple effects of this condition, the impact it can have when you're trying to get pregnant.
Endometriosis creates a really tough environment for fertility. For one, all that chronic inflammation can actually damage the quality of your eggs. Then, in later stages, you can get scarring and adhesions that can physically block your fallopian tubes. And on top of that, we know that people with endo often have a lower egg count to begin with.
This is why if you end up doing IVF, you can't just follow the standard playbook. The whole game plan has to change. The #1 goal is to get that inflammation under control before you even think about transferring an embryo. This usually involves medications like Lupron, which basically put your hormones on pause for a few weeks or even months. It's like calling a ceasefire to calm the battlefield and give the embryo a much better chance to implant.
So, we've been through the symptoms, the crazy diagnostic challenges, the impact on fertility. What is the single most important thing you should walk away with today?
It all boils down to this. Because this disease is so misunderstood, and because the pain is dismissed so often, you absolutely have to be your own biggest advocate. You have to trust what your body is telling you, track your symptoms, and refuse to stop until you find a doctor who listens.
We've unpacked the mystery, we've looked at the clues, and we've navigated the challenges. But this isn't just about giving you information. It's about empowering you to take action. Now that you have this knowledge, what's your next move? The most powerful thing you have is your voice. So the real question is, what will you ask?